Congratulations, your baby's almost here. You've probably thought about how to feed your baby, and maybe you have some long term goals in place. Maybe you're thinking you want to breastfeed for 6 months, a year, or more. Maybe you're thinking, I'm going to wing it. I'm going to see how things go and not set any major long term goals yet. Either way, the first couple of days of breastfeeding have some pretty consistent things with them and some pretty important pieces that will help you on that journey. Right after babies are born, we often call this the golden hour. Babies are very awake, alert. They're seeking out the mom that they've been attached to for all these months. And so we really think it's important that moms and babies are together as much as possible right after delivery. Skin on skin is fantastic. Get your baby up on your chest. Your baby will seek out the breast, and you'll figure out ways to help lead your baby there and get started on that first feed. After that first couple of hours, babies tend to get pretty sleepy. They've been through a lot, as have you. So they may get into a deeper sleep here for the next maybe 12 hours or so. This is a great time for you to take a rest also, please. It's a great time to spend lots of skin on skin time, but there might not be a lot of feedings at the breast, and that's okay because they're going to get revved up pretty soon, and then we're going to go into high demand time. So that next section of time, maybe the second half of the first day or heading toward 24 hours, babies are going to go into a mode where they want to get to the breast frequently. Now, don't let them fool you. This isn't because they need large volumes. Colostrum is a power-packed thing, and small amounts are perfect for your baby. They're going to the breast frequently because the demand will build the supply so that when their volume need comes later, the milk supply will be there. So babies might want to eat as often as every hour for several hours in a row, but we definitely want to make sure that we're focusing on babies getting to the breast every 2 to 3 hours by the second day. This is a great time to practice. Nobody expects this to be perfect in the first 24 to 48 hours. You might have watched videos, you might have read books, and you might go in thinking, I'm going to do it this way. And then you try it and it feels awkward. The arm this way doesn't feel good. You can't get comfortable. Baby doesn't feel stable. Remember, the goal here is to find a comfortable position for you that provides good support, stabilization, so that your baby can feel comfortable and get to the breast and establish that wide mouth latch on the breast. Okay? So, trial and error. See what feels good for you. The most important thing here is don't forget yourself in this. You need to be comfortable. And yes, this might feel like a bumpy journey, but it shouldn't be a painful journey. If things are painful, we need to make something different and we need to make a change. So there's where it's important to reach out to nursing, reach out to your lactation support, see what little tips or tricks can happen to make sure that your baby is latched onto the breast well and not causing damage to you and moving milk efficiently for them. By about 48 hours in, most babies are going to the breast at least every 2 to 3 hours. They are peeing. Their poop might be starting to change over from the thick tarry stuff, but not all the way over yet. And you might be noticing some more fullness to your breasts. It's okay if you're not. Your medical staff will let you know if your baby needs something more than what they're getting from you, but most babies don't. Remember, colostrum is really power packed and only small volumes are needed. But by doing what you've been doing and putting the baby to the breast frequently, that volume will increase. And about this time, generally, is about the time you're going to be heading home. You've been in the hospital or birthing center with assistance. Take the things that have felt better for you, and let's see how those work at home. Find a comfy spot when you get home. Sit down with your baby. Try a chair, try a couch, try the bed. See what feels good and what position works for that comfort for you and stable, good positioning for your baby. You're going to be there a lot. Frequent feeds are the name of the game right now. Babies are pretty one-track mind. Eat, sleep, and grow. So get your baby to the breast frequently. Remember, pain is not something that should be part of this. Bumpy, trial and error, trying different things, absolutely. Trust yourself. You will figure out what works well for you. But if this is a real struggle, and if this is painful, reach out to your pediatrics office, reach out to your lactation support. And remember, we here at Simply Fed are available with virtual consultations for you and your baby as well.